Hi, my name's Danielle, and I am CEO of Most High Foods and MHF Clinic Nutrition and Health, and I'm also a sickle cell warrior. And today, for June the 19th, World Sickle Cell Day, I wanted to do a little video about my journey with sickle cell, my experiences, and a little bit on what I went through and how I've helped my health and my sickle cell. So, firstly, I was diagnosed with sickle cell SS at the age of 13 years old. I was tested as a baby, but sometimes tests for sickle cell can give you a false positive because of the amount of other hemoglobins that are in a baby's bloodstream, which can mask over the sickle cell blood cells and give a false positive a false negative of sickle cell anemia. So up until I was 13, my parents assumed that I didn't have sickle cell until at 13 I had my first sickle cell crisis, which was very daunting, being in my teens and going through that experience. It affected my behavior. Growing up, I felt very much hard done by getting that diagnosis, and it made me very determined to prove the doctors wrong, because as I was diagnosed back in the 90s, I was basically told by doctors that I wouldn't live to see 30 years old, I wouldn't have children, and life for me would be very difficult. Being told that at 13 years old was very frightening, and it also made me very angry because, one, I felt like I didn't ask for it. Two, I felt like that the doctor was writing me off because I didn't feel like all these things could go wrong or could be wrong with me. And I always wanted to be a mum, especially growing up at that age of receiving that diagnosis. I was often babysitting my little cousins. So being around babies and having that experience with children grew me to want to be a mum. So being told that I couldn't have children was hard. It wasn't a nice thing to hear. Um, but I think me finding out so late in the day, I didn't kind of submit to the doctor's diagnosis. I was adamant that I was going to live a normal life like my friends, and I tried my best to do that, which was difficult at times because you can't change your blood, you can't change how sickle cell affects you as a sickler. So I would try my best to keep up with everybody my age group and suffer the consequences later. And I kind of still keep that mentality to keep going until your body tells you you cannot anymore. And I think it's having that mentality is why I've been able to experience a lot of things that I have experienced and gone places that I have gone in my life. It was difficult for my mom because she also had my brother who was diagnosed with sickle cell from a young age. So she had to manage my health and my brother's health. She was very traditional Caribbean, decided to make sure that me and my brother were eating the correct things and doing what was right for ourselves, but not placing too much reliance on medication, but keeping us healthy via the way we eat. So she kept a lot of our traditional Caribbean diet with hard food and things like that. But as I grew older, I began to realize that my diet, especially the amount of meat that I consumed, was affecting how my sickle cell affected me. So the older I got, the more I learned how to adapt my health and my eating habits and how I looked after myself and the medication I took. My experiences with medication have been touch and go over the years. I've had some great doctors and I've had some not so great doctors. My first doctor was a not so great doctor who basically put me on penicillin, folic acid, which I was made to take every day, and obviously the pain relief for when I have sickle pain crises. So when I had these crises, that's when I would use the pain medication, but I was made to take penicillin every day and folic acid every day, which I did for many years. And by the time I reached about 18, 19, I found that I was in hospital on a weekly basis. If it wasn't a weekly basis, it was every 2 weeks I'd be in hospital, either having IV antibiotics and fluids, pain relief, or a blood transfusion, which was monthly. So I would be often in hospital being treated for my sickle cell. I began to be known by porters. They would see me and know me because I was in there so frequently. So when I did get to the age of 18, 19, I realized that certain things were not agreeing with my body, like penicillin, having penicillin every day and having the flu vaccine regularly. I began to realize that they were affecting how my sickle cell behaved towards me. And when you have the comparison of how your body feels before those medications and after, you do feel the difference in your body. So by the time I got to 18 and had my first child, that was my open big wake up call that opened my eyes and said, well, obviously I've managed to prove the doctors wrong to stay healthy enough to have a child at 18. That was my big wake up call to stop being so you only live once and take my sickle cell and my health seriously. So from having my son Jaden, who is now 21, that made me realize that a lot of the things that the doctors do tell me is not 100% facts. So I began to assess my own body, my own symptoms, and how the medication that doctors gave me affected me. So by the time I had my second child, I came to realize that my diet played a big part on how often I was having sickle cell crises. Um, by the time I had my second child, I began to realize that me having the flu jab was in fact making things worse for me personally. And I feel better in the winter without having the flu vaccination. But however, me not having the pneumovax turned out really fatal for me. The minute I didn't have the pneumovax and it came to winter, I'd end up being really ill, and with pneumonia, also catching flu even more easier if I didn't have the pneumovax. So I began to realize by the time I was in my 20s that there are medications that agree with me and there are some that don't agree with me. I began to realize that me taking penicillin every day was not helping my sickle cell, because when I did get infections and I did get sick, they would have to take I would have to take extremely strong antibiotics, because the normal antibiotics just wasn't working. I had become immune to antibiotics. So I stopped taking penicillin every day and started to take it as and when my body felt run down, or I felt a cold on my chest, or even breathing felt slightly labored. That's when I'd go back to taking my penicillin. Um, I began to monitor my health a lot more after having my second and third child, because by the time I had my third child, my health was really deteriorating. Um, by my third pregnancy, I could feel how my body had changed a lot. It was much weaker. I felt much more ill. I was in and out of hospital more frequently by the time I got pregnant with my third child. And it took me going for my diploma and trying to understand, because I was at the end of my tether, fed up of feeling very sickly, feeling constipated, lack of energy, but still keeping up with my medications that the doctors were telling me to take. So I was frustrated and decided to go for a diploma in nutrition and health, which I thought could help me understand an alternative way of trying to keep myself healthy. So I did this and I began to learn how to look after my body properly without the aid of medication, and learn about what would help my sickle cell and help my blood. So I finished that diploma and I came across a lot of different kind of health products which I tried and experienced, but then I began to realize the expense of keeping up with a lot of these multivitamins and these capsule products and shake products is really expensive, and there must be another alternative way. Hence why I set up at Most High Food Sea Moss Jelly, which is on Instagram and Facebook. Please like, share and follow. That's when I started to use my traditional foods that my mum and my gran taught me how to make, which is sea moss. All those years of knowing how to make it, and knowing that my gran taught me how to make it while she was making a drink called Irish moss, which many Jamaicans will know. And many people who like Irish moss would know that it's very good for you. But the thing about Irish moss is that it's got milk in it, and I never really was a big fan of drinking milk. So getting into the know about nutrition made me realize how nutritious the sea moss was, that it could really help my sickle cell if I took the dairy out of it. So I began to make it for myself, and I really did see the change in my health. I saw the change in my skin. I began to manage to maintain my weight. My hair began to grow, and I became less reliant on pain medication and penicillin. So that was my first wake up call on learning to look after myself and my sickle cell, and also communicating with my doctor what works and does not work for me and my sickle cell. So the medications that I take, my doctors still make sure that I have my folic acid and penicillin and my oral morph and diclofenac prescribed to me, but they're also aware that I do assess my own health and make sure I compare good and bad days, and also they listen to what works for me and what doesn't work for me, which is really good to communicate with your doctors. Don't be afraid to say what works and what doesn't work for you. And I've basically been able to maintain and manage my health, working with my hematology team, and also applying my nutrition and health education. And now that I am pursuing a doctor to become a doctor in health and nutrition. It's given me that wider spectrum of understanding about the body and the blood and what the blood needs, and how I can apply nutrition to help my sickle cell. And as and when I graduate, I hope to be able to show many other sickle cell sufferers how I maintain good health and how I manage my weight. Every day is not going to be a great day, but it is amazing, and I am extremely thankful at the place that I am today, because all those experiences that I have had, um, be it mistakes in hospital because they're not understanding my health, or me having the wrong kind of medication because it's not been tried on me before. All these experiences that I've been through over the years of over my 40 years, I was 40 this year, so over the 40 years of me having sickle cell, those experiences have given me my own little personal portfolio of how I keep myself healthy, what works for me and what doesn't work for me. And what I found works for me is listening to my body first and foremost, and also having a understanding doctor who listens to their patient, who understands that patient, knows how their body feels, and works with the patient alongside medical information that is in place to make sure that people like myself who suffer with sickle cell are living the best life that they can live. Um, I found taking a lot of the medication that we are prescribed as sickle cell warriors, they were making me feel really ill. And by the time I got pregnant with my last child, um, which kind of pushed me on to doing the diploma and then pushed me into going for my degree, is because I felt like I was at death's door when I was pregnant with him. And I don't know if any other sickle cell sufferer would identify, but after having him, I was really scared, and something that I didn't express to anybody else. I kind of kept it to myself. So I was really scared that I wouldn't be around to see any of my children grow up, especially the fact that I nearly lost my last born Sharik because he had a placenta abrasion, and I assumed it was a sickle cell crisis. So I stayed home um, nursing a sickle cell crisis until the pain got so bad. It's not until I went to A&E and they said that we need to rush you to theatre. We need to give birth to your baby as soon as possible because we possibly might lose you and the baby. That was my big wake up call, that I needed to do something about my health, and I needed to make sure that I am fit enough for my children, to be around my children, watch them grow, and they not go through what I went through and losing my mum at a young age. So I basically have been dedicating a lot of my time and energy in learning about my body, learning about nutrition and health, and becoming a doctor in nutrition, which has improved my health. I've now managed to maintain weight. I'm in hospital less. Um, and having that understanding about my body, I hope to be able to share with other sickle cell warriors, as that is my aim and my goal for my dissertation, for my degree, is to put things in place and give patients as well as family members understanding on how to look after a sickle cell sufferer, um, to have understanding on what a sickle cell sufferer needs as a parent, what you should feed your child, as a partner, how you should treat your partner, what you need to do to be there for your partner to make sure they're not overdoing it, and also to put things in place for parents as well as carers of children with parents of sickle cell. So my eldest son was a sickle carer. sickle cell carer because I was a single parent when I had him. So it was a lot of the time just me and Jaden. So before I met my partner, where I had my other two children and we're together now. So him growing up, he felt he had to look after me growing up as a sickle cell carer, and there was not much in place for him growing up, for him to have an understanding about what his mum has. And he basically felt like he had to look after me, which made him kind of grow up a bit too quick, which I was thankful for my mum and dad, who would take Jaden away for the whole weekend and give me that little respite, and also make him be a child as well, not feeling like he had to look after mum. So as I approach my last year of my degree, I am thankful for, one is my health and how I've been able to maintain my health with help from the NHS and my hematology doctors, and also teaching myself how to love myself, to look after myself, and to know what to eat, and also to be having that perseverance to push for better knowledge and education for fellow sickle warriors. So in the spirit of World Sickle Cell Day, I am sharing this video to let people know there is life beyond sickle cell. You can have a normal life, you can feel healthy, you can have children, you can accomplish the goals that you wish to accomplish regardless of sickle cell, as long as you are being supported and you have the knowledge and the support that is out there to look after yourself and to maintain health. And I'm thankful to be able to have a platform like Most High Foods sea moss jelly and MHF Clinic Nutrition and Health to show people a sickle cell warrior that has sickle cell and still lives life, has a family, studies, goes through ups, goes through downs, lives a normal life. It's my pleasure to be able to show other sickle cell warriors that there is a life beyond sickle cell, that yes, we do have bad days, but if we know how to look after each other, to look after ourselves and support each other and support our doctors, while also having that respect from our doctors that we know our body and that we also are learning how to look after ourselves, just like doctors learn how to look after patients. So please, anyone who knows someone who has sickle cell, or if you have sickle cell yourself, please like, follow and share Most High Foods sea moss jelly and MHF Clinic Nutrition and Health, and keep sharing awareness and information. The more information and awareness out there and support out there is the more sickle cell warriors that will not have to suffer the way Even did and many other sickle cell sufferers have experienced in hospital. So please share and support all the platforms that are supporting June 19th sickle cell awareness, such as Unsickle My Cells, Sickle Khan, We Are Not the Same, and Give Blood NHS. Thank you for watching. Blessings.